Being Surgeon General, nobody's prepared for. You know, all of us have our training, our education, and remember, up through me, there was only 17 Surgeon Generals of the United States, a position that began in 1798 when President Adams realized that the country needed, at least then, rudimentary health care, mostly because we needed to protect the country, which was just a few colonies back then, from all of the commerce that was occurring and disease that was coming into our shores. Now, of course, there was no germ theory. Nobody knew how it would happen. There was a lot of crazy thoughts in those days. But the president said, you know, we need to create something that's going to protect us. And he created what was called then the Marine Hospital Service in 1798. Around that time, he also created the Marine Revenue Service because he said, you know, we really need to start charging tariffs for all these ships that are coming in. The Marine Revenue Service today is called the United States Coast Guard. The Marine Hospital Service today is called the United States Public Health Service. All began back in 1798, shortly after we went from a continental Navy to a U.S. Navy, from 6 frigates to a bona fide Navy, and the country began. So the U.S. Public Health Service and the Surgeon General, which was called Supervising Surgeon back then, have been with this country since the beginning of time. And so when you step into this position, it really is quite an awakening because there's no training for it. There's no education. And trying to understand the complexity of this politically charged environment we call the Beltway, and landing there and thinking, okay, I'm going to be different. I'm not going to be involved with these politicians. I'm just going to be the doc of the nation, and I'm going to do my job. I'm going to stamp out disease and famine and pestilence and make the world a better place, and then I'm going home. You know, it doesn't work that way. And the fact is that the public health issues that you all hear about every day, that you look at and you say, well, this is pretty straightforward stuff. We have evidence-based, we have science, but those become the most contentious debates you have ever seen, where each side of the aisle is willing to fall on the sword for certain things. And yet the Surgeon General really is the true nonpartisan arbiter of what best science is. And polls have repeatedly shown that the Surgeon General is the most credible, visible person in the federal government. Why? Because, think about it, when one of your political leaders, no matter where you live and which side of the aisle you're on, when somebody speaks who's from a party other than your own, immediately you discount them. They're just a politician. We can't trust them. But think about it. When the Surgeon General speaks, in the history of this nation, nobody has ever accused the Surgeon General of being partisan. Nobody has ever accused the Surgeon General of taking political sides. And in fact, it may be the one office in the federal government that has never had a scandal. We've never taken money. We've never had, you know, sexual impropriety accusations, all the stuff you hear about in the political world, because the Surgeon Generals realize that once you step into that position, you are not the doctor of the Republican or the Democratic Party. You are the doctor of the people. And your job is maybe the most important of all, is really talking to the people in a health-literate, culturally competent manner in order to effect behavioral change based on the best science and nothing else. Now that may sound simple, but when you have such a position of authority, and the authority is not so much that you're an admiral or surgeon general, the authority is really given to you by the American public because they trust you and what you say. And so then when the Surgeon General has the privilege to release a report like the secondhand smoke report that you spoke about, it was tough to get that out because there was a lot of, shall we say, political unrest in an attempt not to put it out there because of the fact that certain groups didn't want that information out there. Yet this report was filled with years of science and made it clear that smoking, secondhand smoking, was not merely a nuisance, but in fact, secondhand smoking kills. And the fact is that because the Surgeon General released it, within a year we had about 25 states that acted on it. And we started seeing smoke-free spread across the United States. Within the second year, every country in the world used that document to make changes. For those of you who have traveled to Europe and you've been to Greece or Spain or France or Italy, when you couldn't find a smoke-free area, now there are smoke-free areas. Why? Because not only our nation, but the world trusted the Surgeon General as being an impartial broker of good science for the benefit of people, and understood that we needed to translate this in a culturally competent, health-literate manner, which makes it even tougher because the Surgeon General often speaks to the world because everybody does watch what we do around the world. And what we say has rippling effects. And as has been cited already, my colleagues at the CDC and the epidemiologists have said, boy, you know, when you look at this report and you factor it out in 20 or 30 years, it can have staggering positive health effects in the reduction of disease, morbidity, and mortality, and so on.